So diagnostic criteria, here we have two scales, very important for all the DRNB and DM trainees to know: the Cairo-Bishop score and the Howard's criteria. So this Cairo-Bishop score was basically introduced in 2004 and it classified TLS into two types, either the laboratory TLS or the clinical TLS. So laboratory TLS is very easy. We saw there is hyperkalemia, there is hyperuricemia, there is hyperphosphatemia, and there is hypocalcemia. Or in general, you see, there is increase in all these components 25% from the baseline, or a decrease of the calcium 25% from the baseline. And what does it says is, 2 or more of the following metabolic abnormalities should occur within a 24-hour period from, as we discussed, 3 days prior to 7 days after initiating chemotherapy. So you need 2 criteria to happen within 24 hours, wherein it could be increase in the absolute value, or it could be even a relative increase, that is 25%. That is defined as a laboratory TLS. Whereas when we come to a clinical TLS, it says that there should be one laboratory TLS plus 1 or more of the following, that either you should have a renal insufficiency, that is increase in your creatinine to 1.5 times the upper limit, or some cardiac arrhythmias or seizures. Nothing but a manifestation of your laboratory TLS should be seen in the form of symptomatology to call it as a clinical TLS. But one thing you should know here is, Cairo-Bishop's criteria gives you even either it should be an absolute value or even a relative. So your metabolic abnormalities can be either absolute or relative, that is 25% above the baseline. But when you come to the other criteria, that is Howard's criteria totally eliminates the relative elimination. So elimination of 25% from the baseline is completely removed from the Howard's criteria. It basically focuses on the absolute values. So at least there should be 2 metabolic abnormalities which should be present. Same like the Cairo-Bishops, you should have at least 2 metabolic abnormalities within 24-hour period, and that metabolic abnormalities should be definitely what? Your absolute criteria, that is increase in your values, and there should be a symptomatic hypocalcemia. Any symptomatic hypocalcemia is considered indicative of clinical TLS. So when you compare this Cairo-Bishops and Howard's criteria, you find that, as we saw, same 2 or more metabolic abnormalities, or at least 2 metabolic abnormalities within 24-hour period, same 24-hour period. This from 3 days, as we know the definition of TLS, from 3 days prior to 7 days after the chemotherapy initiation. But here there is even the relative values are taken into consideration, but here only the absolute increase in the values are taken into consideration. Here the clinical manifestation should be definite organ dysfunction in the form of renal insufficiencies, cardiac arrhythmias or seizures. But Howard criteria says any symptomatic hypocalcemia also would be sufficed enough to call it as a clinical TLS.